Hi, I'm Natalie Kelleher. I'm in Section 7. I'm going to be performing IV medication through primary line. First, I'm going to look at my MAR. I see that the doctor has ordered vancomycin 250 milligrams IV every 24 hours. The pharmacy has given me a vial of 500 milligrams per 5 ml, so I'm going to draw up 2.5 ml. First, I'm going to check the expiration date. I'm going to compare it with my MAR, make sure everything's accurate, look at the patient's history, if the patient has any allergies. Then I'm going to draw up my medication. Okay. Then I'm going to take my bag of 100 ml of saline solution. I know that this is really a 50, but we're going to pretend that it's 100. And I'm going to wipe my port. Insert the medication. Then I'm going to toss this into the sharps container. I'm going to mix my medication up. I'm going to take my label, put it on the back of my bag, and I'm going to document the drug, the amount, my name, the date, the time, the expiration date, the patient, the room number, and the start time. Then I'm going to set this to the side. I'm going to take my prime tubing. And normally it wouldn't be this tangled. And I'm going to, once again, I'm going to alcohol wipe here. This is sterile. This would normally have a cap on it. I would take the cap off, spike my medication, prime the tubing, open it up, let it go all the way through. Clamp. Okay, perfect. Once it's all the way through, I will reclamp. Set this to the side. Then I'm going to look over the MAR, make sure that I have everything correct. I have the medication. Now I need to draw up, out of my 10 ml syringe, draw up 6 ml of saline. This is going to be used for multiple purposes, multiple uses. Now I'm going to check the MAR, make sure my medication's correct, everything's correct. I need to label the tubing, the date, time, initials. Gather off my stuff. Then I'm going to enter the patient's room. The first thing I want to do is introduce myself, tell the patient who I am, and then I'm going to ask the patient name and date of birth and look at their wristband. And once I've done that, I'm going to explain the procedure and why the doctor has ordered the medication, and then I'm going to perform hand hygiene. I'm going to apply my gloves. Then I'm going to inspect the IV site for any redness, swelling, edema, pain, infiltration. Once I've seen that everything's okay, I am going to take my saline and wipe alcohol. And I'm going to unclamp, remove the needleless, and put it in the sharps container. Now I'm going to do a Sosh method. I'm going to aspirate. I see blood return. I'm going to pause only 3 ml of the saline. Again. Go over here to my medication line and connect it. First I'm going to clamp this, make sure that's clamped. No, leave it unclamped. I'm going to connect that. Now I need to determine in the beginning my drop factor, my drop per minute, which would be 17 drops per minute. So now I'm going to unclamp and then I would determine 17 drops per minute. And once I've determined that, I will unclamp everything and let the medication run for an hour. Now I'm going to inspect to make sure that there's no redness or swelling or irritation. I'm going to ask the patient the 4 Ps, make sure he's comfortable. Then I'm going to leave the room and tell the patient I'll be back in an hour. And when I come back in an hour, the medication should be over with. I'm going to inspect the site, ask the patient if he has any side effects, make sure there's no redness or swelling or infiltration. Then I'm going to clamp this, turn the medication off, unhook, wipe this with alcohol. I'm going to take my saline flush, unclamp, and then push stop method, 3 ml of saline. Then I'm going to reclamp it, unhook, and just wipe this off just to be safe. And place it down. I'm going to ask the patient if he's comfortable on the 4 Ps once again. I'm going to tell him where the call light button is, and then I'm going to document use of the MAR, time, drug, route, condition of IV site, volume of fluid used, And that's about it. Thank you.